This Focus on Health segment is brought to you by Aurora Health Care.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Health Center in Oshkosh, and we're in the doctor's offices for the surgeons here at the clinic. Today we're discussing high-risk breast cancer screening. And we have two guests for you today, starting with Ruthann Peck, who is a physician assistant here at Aurora. Well, thank you for joining us today. This is basically a program that began in the spring of 2010, and we're talking about people who are at high risk for breast cancer. Who would you consider, what group would be considered high risk in this group?
Well, when we're trying to decide if an individual is at high risk, we try to look at them as a whole. We'll look at medical history, family history, and social history. So there's a few things that play into that. Some of them are fixed things about an individual, such as their genetics or their family history, how many people in their family have breast cancer, also the age, race, things for a woman like breast density, when they start having periods. Those things we look at. If they've ever had to have a breast biopsy done and what that showed. There are also other things that are variable for an individual, such as if they're a smoker, if they drink alcohol, and also diet, weight, and exercise play into it too. So we try to look at all those things and kind of determine what a woman's risk is and if it's elevated or not.
And one of the ways you're able to determine if they're at high risk is through a program or a model called the Gale Model?
Yeah. The Gale Model is a clinically validated tool that's used by primary care providers sort of as a screening technique to identify these individuals that may be at high risk for breast cancer. It uses about 5 or 6 questions asking a woman's age, her race. It asks if she's had any children and what age her first child was born. It asks if she has any history of breast biopsies and what that biopsy showed. And I think, it also asks about family history too, again, because that's a big key. So what that does, it's a program, it's a real easy questionnaire, and you can take the answers to that question and plug them in, and that will generate a percentage number, which will be the woman's lifetime risk for developing breast cancer, and also her risk in the next 5 years of developing a breast cancer.
Now, does a woman need to come here to fill out that questionnaire, or is there a different place
She can do that, and that's perfectly fine. We're happy to see any individual who wants to do that. Right now, we're starting a program at Aurora where we're using this Gale model at the primary care level. So if an individual comes in for their annual physical, they should be talking about this or having a discussion about this and hopefully filling out this questionnaire there. And at that time, we can capture anyone who's at high risk, and they can hopefully be sent to us. And when they come to see us, we can go over this model and also run some different risk assessment models to determine, if they are at an increased risk, and we can talk about how to manage that.
So that's when you want to see somebody who is considered high risk probably as soon as possible.
Yeah, absolutely. Right now, actually, we can see somebody in 1 to 2 days if we have a primary care provider who they've identified as possibly being high risk. They will send them over to see us. They can also just come here if somebody has any questions or they think they may have, family history. In addition to that, there are some red flags for individuals besides using the Gale model that can be really serious and affect a lifetime risk of breast cancer. And those would be greater than 3 individuals in a family having breast cancer, any ovarian cancer, a male breast cancer, bilateral breast cancer, or a known genetic mutation in the family. So those are some individuals that we'd like to see and, do a further risk assessment on.
Okay, great information. Thank you for joining us today.
You're welcome.
And joining us now is Dr. Rich Kiefer. He's a surgeon here at Aurora. Thanks for joining us today.
My pleasure.
Let's talk a little bit about the preventative tests that are available.
So, preventative testing for breast cancer is really based on a woman's risk. When we see a woman in our high-risk clinic, one of the things either Ruthann or I will do is we will take a detailed family history, sort of a pedigree, and that will, there's numerous validated risk assessment programs that will run them through, and if they are come out at an elevated risk, there are guidelines that have been developed by the NCCN, the National Comprehensive Cancer Network, for management of these women. And the testing boils along two paths. If the women look like they have a familial breast cancer or hereditary breast cancer, there are genetic testing and genetic counseling available through our genetic counselor here at Aurora. And we'll refer them down to our genetic counselor for BRCA testing or other testing as needed. And we also do, in addition to regular mammography, we'll do MRI. It's been shown that MRI on an annual basis is a benefit as far as early detection in women that are identified at high risk. In addition to that, there's also some preventative drugs that can be used to actually reduce a woman's risk of breast cancer. We can actually put them on tamoxifen or Avista, both of which have been shown to reduce a woman's risk of breast cancer.
Okay. Now, I understand that Aurora is an accredited breast cancer center.
Yes.
What does that mean?
Well, about 3-4 years ago, it'll be 2 years ago now, the American College of Surgeons developed, in conjunction with multiple other specialties, a accreditation program for breast centers, and Aurora Baycare was the first breast center accredited in the state, and Aurora Medical Center Oshkosh was reviewed the next month. So we've been accredited for 2 years now. And what that means is that there are 29 guidelines or 29 points that we have to meet to be accredited to show that we're proficient. It means that you have a surgeon who is interested and shows dedication and interest in breast surgery, and in addition to adequate medical and radiation oncology, interest in, you have to have genetic counseling, a whole array of services that show a multidisciplinary approach to breast cancer. So we have a multidisciplinary team here that meets every other Wednesday to review all of our breast cancer cases. So all of our breast cancer cases are discussed at least once by a multidisciplinary team, including radiology, pathology, genetic counseling, plastic surgery, and radiation oncology.
Okay. If somebody is at high risk or needs to see you or wants to see you, do you prefer that they go through their primary care doctor, or can they make an appointment with you or Ruthann directly?
They can make appointments with us directly. We'll see all comers. We're happy to see anybody and everybody who wants to come see us. It's not a problem. They can just call the office and make an appointment to see us for a risk assessment or second opinion. We'll be happy to see anybody.
Okay. If you'd like to know more about high-risk breast cancer screening or to schedule an appointment with Dr. Kiefer or Ruthann Peck, call the Aurora Health Center at 920-303-8700. I'm Ted Stefaniak. Thanks for watching. We'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.